Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Knee to Know Show, we're going to talk about stiff knee after knee replacement surgery and how to manage it effectively. So, when it comes to having a stiff knee or a tight knee after surgery, we first want to rule out any serious kind of red flags, we'll call them, or just kind of issues that can't be addressed just through conservative management, and you need to consult with your doctor, your surgeon. So things like a fracture, things like bleeding, infection, poor size or fit of your knee replacement, things like this really need some sort of intervention from the surgeon or from your doctor. So we want to rule out those potential causes first. Now, if none of those things are going on, then we want to try our best to manage a stiff knee and a tight knee with conservative treatments and interventions. There is the options of manipulation under anesthesia or an MUA, where they go in and they manipulate that knee and try to break up the scar tissue. There's the options of surgeries and other treatments, but let's talk about just the basic first line of defense conservative treatment options out there. So first thing is you want to make sure you're staying on top of your pain after surgery. The best way to break up a stiff knee and to improve your range of motion and mobility of that knee is through moving it, bending it, straightening it, exercises. And if you have so much pain and swelling and stiffness and achiness that you can't tolerate physical therapy or tolerate exercises and movement of the knee, then you're not going to see those improvements. So this means things like making sure you're taking your pain medicine as prescribed and as instructed. It means using different techniques to manage pain. Things like icing, things like using elevation and compression to help bring that swelling and bring that fluid out of the leg and out of the knee. It means using things like maybe massage to that knee, or using electrical stimulation or TENS to help manage that pain effectively, so that then you can tolerate the things that are going to help improve that mobility. Especially early on after surgery, you're going to be more limited in your range of motion and mobility by pain and swelling and inflammation than you are going to be limited by scar tissue. Scar tissue takes a little while to lay down and form. So you're more limited by this swelling and pain, especially early on, than you are from scar tissue. The second thing I would recommend is move that knee, stretch the leg early and often. This is extremely important and is going to be the main way that you're going to get your range of motion back, your mobility back, and break up that stiffness and that tightness, is bending the knee, straightening the knee, bending the knee, straightening the knee. You want to really be consistent and diligent with this. Especially early on after surgery, you're doing this multiple times a day, 3 to 5 times a day. You're running through some exercises, some range of motion activities, bending the knee, straightening the knee, getting that movement back. This also means things like prolonged stretches. So putting the knee in a fully extended or straight position and trying to keep it there and slowly build that stretch and break up that tissue and swelling and discomfort. And the same thing with putting the knee in a bent or flex position and trying to hold that for a prolonged stretch. Both really helpful and really beneficial. You can do everything else on the outside, but at the end of the day, you're going to have to move that knee. You're going to have to bend it and straighten it. And the third thing is just try to get back into normal activity. Get back into what you would normally do. There may be some pain, some discomfort, some achiness and stiffness, but the more you can get back into activity, it's going to have a lot of tremendous benefits. It's going to help decrease the sensitivity of your nerves and your nervous system, so they're going to feel more comfortable allowing your body to move. You'll notice as you're just walking and doing things, if you're preparing a meal in the kitchen or you're tidying up and doing chores or whatever that may be, you're just going to notice that kind of on this unconscious or subconscious level, your body's just going to want to move like it naturally does. Your body will want to move, and your knee will want to move and bend as long as you let it do that. I work with people who they're starting to walk and trying to walk after surgery, and they're very tensed and they're very nervous and kind of have this fear avoidance, which is perfectly normal and just a normal response of our body trying to protect itself. But it's okay to move, it's okay to relax. You're going to have some pain and discomfort. It's going to feel a little weird, a little strange, but get back into that motion, get back into that movement, and then you're going to start to notice that just unconsciously or subconsciously, your body's just going to want to start moving normally again. It's going to want to start putting weight through that leg. It's going to want to start bending and straightening, because that's how your body moves efficiently and effectively. So the more you can just kind of work your way back into normal daily tasks and normal activity, it's actually going to have tremendous benefits. So again, make sure you're staying on top of that pain and swelling and symptoms to be able to tolerate those bending and straightening exercises. Make sure you're moving that knee, stretching that knee early and often and consistently. And then just make sure you're trying to work your way back into walking and your normal daily activities as much as you possibly can. This is a marathon, not a sprint. It's going to take some time, but with these tasks, the majority of people through these conservative treatments can really see tremendous improvements. Thank you very much for watching. Be sure to hit that subscribe button, turn on notifications so you can catch all of our videos and all of our latest content. Be sure to leave your comments and questions below, and I appreciate any likes that you give, as that helps spread this video out to other viewers. Thank you very much for watching.